A new research study underway in the emergency department at Foothills Medical Center shows promise for speeding up the diagnosis of patients who arrive with heart attack symptoms.
Troponin is a structural protein released from the heart when the heart muscle dies. And so when people have a heart attack, which is caused by a lack of blood flow to part of the heart muscle, the troponin gets released into the bloodstream. And so when a person comes to the emergency department with chest pain and we're concerned about a heart attack, we do an electrocardiogram, which for most people will not clearly diagnose a heart attack. So you can have a normal electrocardiogram and yet still have a heart attack. And so the mainstay of diagnosing heart attack is checking for a change in this troponin level in the bloodstream.
The new generation of troponin tests is 10 times more sensitive than the previous version, which decreases the risk of missed heart attacks while maintaining a low risk of false positives. The current process requires repeat blood tests that can take between 6 and 12 hours to complete. A new generation of tests could reduce this to as little as 1 or 2 hours.
With the old test, you could have had, again, a normal initial blood test. You have to wait a period of time to repeat it because it may take several hours, 6 or more hours, for the level of the troponin to rise in the bloodstream to where it's detectable by the test. With the new test, virtually everyone we test has a detectable level. And so again, we can look for changes in that level to see if there's signs of ongoing heart damage and diagnose a heart attack sooner, as well as more quickly tell people that they haven't had a heart attack and safely discharge them from the emergency department.
45-year-old Calgary engineer Juan Garcia is a study participant who appreciates the potential benefits of the research.
When you're told, look, we took a blood sample, it's positive or negative, but we gotta wait another 6 hours to confirm, right? That is a long wait for sure.
Garcia went to the emergency department at Foothills at 8 a.m. with chest pains, but it wasn't until 9 p.m. that doctors were able to rule out a heart attack. The new test will significantly reduce the amount of time doctors and patients spend waiting for results.
It'll benefit everyone, right? Every patient that comes here with what they feel like symptoms of a heart attack, they will have a lot sooner a confirmation whether it is heart-related or not.
In Garcia's case, it was determined that he was experiencing some recurring muscle pain that had flared up as a result of a previous bypass surgery.
85% of patients who come to the hospital with chest pain do not have a heart attack. They're having things like acid reflux in their stomach, heartburn, could be pain coming from the muscles in the wall of their chest, could be other things like pneumonia or other breathing problems. It's partly pattern recognition, but it's also objective testing data from things like electrocardiograms and from this troponin test that helps us either rule in or rule out a heart attack. So the idea is that we'll be able to have objective data from this test to tell us who is and who is not having a heart attack without having to rely on gut feelings or intuition.
It's cutting edge in North America because there are very few centers in North America that are using it. It is not approved in the United States. We're one of the few centers in Canada to be using it. And so this could potentially change how we test for heart attacks, not only in Calgary, but across Canada and across North America.
Symptoms of a heart attack often include chest pain or shortness of breath, but can also include nausea, lightheadedness, a fast or irregular heartbeat, or pain that spreads to the neck, shoulder, or arms. Anyone experiencing symptoms of a heart attack should call 911 and seek immediate medical attention.